On day of admission, the spasticity team will meet you and complete a safety check on your pump to check the dose setting and that the catheter is working. We will examine your legs, take bloods if required, plan your bladder and bowel management with you, explain the pathway again and answer any questions you or your family may have. The anesthetist will visit, they will review your health, explain fasting times and insert a thin tube called a cannula into your arm. The surgeon will visit to discuss the procedure including the risks and benefits. They will mark your skin near the pump site and ask you to sign a consent form. A family member can be present if you wish. The anesthetist and spasticity team will plan your morning medications with you. The ward nurse will prepare you and take you to theatre, where you will meet the staff who will be wearing theatre gowns. Your spasticity nurse will stay with you throughout the procedure. Having an operation is an anxious time for anyone. Knowing what to expect may make it easier. Operating theatres are cold, but don't worry, you will be given a warming blanket. You won't be able to see the procedure, but can of course ask questions. Many people bring in a mobile device and listen to music, catch up on a podcast or audiobook. To prevent pain, the doctor will inject a local anesthetic, like you might have had at a dentist, around your pump site. This may feel like a sting or a sensation of cold during the injection. The surgeon will check that it feels numb to you before making the incision. You may feel a little pressure when the old pump is removed and the new one inserted. It should not hurt, but if it does, tell the nurse so more anesthetic can be given. The surgeon and nurse will complete all safety checks to make sure the new pump is working. When satisfied, the surgeon will close the wound with stitches or clips and put on a dressing. The whole procedure should take less than an hour. Once surgery is complete, you will be placed back in your hospital bed and moved to recovery, where the nurses will carry out observations and offer a drink. The pump area remains numb for a while. As the anesthetic wears off, you might feel pain. If this happens, let the nurse know, and they can offer pain relief. The spasticity team will start your pump at your regular dose before you return back to the ward. You can eat and drink as normal once back on the ward. The spasticity team will visit 4 hours after the new pump was started to review your spasticity and wound before approving discharge home. Hospital transport can be arranged in advance if required. Before you leave, your spasticity nurse will explain how to keep the wound dry and clean for at least 10 days. This means no shower or bath during this time. Provide you with a pump manual and organize a new pump identification card. Invite you to join the implant register to keep details of the pump on record. Arrange a home visit by a district nurse to remove clips or stitches. Organize telephone review and pump refill visit appointments. Explain that if you have any questions when you get home, you can contact the spasticity team or ward team for advice. In the first few days, you may find you have to adjust your transfers and take things slower. You may need extra support at this time. Remember that you should avoid overstretching, twisting or bending, and try to avoid direct pressure on the wound from a tight waistband or lap belt. It is important to rest and eat and drink well to aid recovery. If you feel discomfort at the wound site, paracetamol is usually the best thing to take. Once ready, try to get back to your normal exercise and stretching level. Your new pump should work exactly the same as your old one. If you have any concerns, please contact your spasticity nurse, or during out of hours call the ward nurse, who can contact the neurologist on call. So let's recap. The benefits of having your pump replaced under local anesthetic include less invasive technique, reduced risk of breathing problems, nausea or infections, and a shorter stay in hospital. Thank you for watching our second episode. This film was funded by the National Brain Appeal, the charity dedicated to supporting the National Hospital for Neurology and Neurosurgery.